Yeah, so we also have a study, a systematic review of the literature on patients who develop acute pancreatitis from a viral cause that also had an hepatitis inflammation of the liver infection at the same time. So they have acute hepatitis with acute pancreatitis. We found around 71 cases, and the most common cause was acute hepatitis A, and then acute hepatitis B, and then E. So those were the three most common. Only one case of acute hepatitis C with acute pancreatitis were found. These cases of acute pancreatitis were thought to be from the virus, so other etiologies were excluded. And we found that patients with hepatitis A and E had relatively good outcomes. They had mild inflammation of the pancreas. However, patients with hepatitis B had really more severe outcomes. They had about 80% of them had severe acute pancreatitis as classified by the revised Atlanta classification, and they had a very high mortality. They had around 50% mortality, which is very high for acute pancreatitis. So I thought this is an interesting project that may help all healthcare providers, not only gastroenterologists, to be aware that if you encounter a patient that has both acute hepatitis and acute pancreatitis from a viral etiology, those patients with hepatitis B will have very high mortality. The optimal way to treat a patient with acute viral hepatitis and acute viral pancreatitis would be supportive care in most cases. Cases of acute hepatitis are usually treated depending on the cause and the virus. We need to do supportive care. In the case of hepatitis B, there is also antiviral medication that we can use. And in the case of hepatitis C, it was only one case, and it was thought to be more supportive care that the patient received and did well rather than other antivirals. So I think the take-home point is to treat these patients with supportive care. And also, if they develop hepatitis B, the immunosuppressed state of the patient, if they are immunosuppressed, they may have poorer outcomes, and they may need a nice intensive care unit to receive the appropriate supportive care for the viral infection.